And this is about patient dumping, I think. Is it not, Mr. Bales?
Yes, thank you, Senator
Over to
Kuehl.
you.
I wanted to thank Gil Cedillo for all that he's done to help us work on
He was
the
here for the
problem in
first part of
Skid
the
Row. I
hearing,
know.
but unfortunately, of course, we have other committees that we're kind of required to be, but he's very happy to be doing that, and a lot of us are co-authors of those bills as well.
Thank you. Thank you very much. Unlike other unfortunate souls who've been dumped or dropped off on Skid Row, I've worked my whole life to end up on Skid Row, and I finally made it. And I want to make sure that no human being is left on the streets of Skid Row. And 3 years ago, my predecessors found that a woman had been dropped off by a hospital. She walked in with an IV in her arm, sat down in our guest area, and died 10 minutes later from pneumonia. And we set up what is now called a hospital dump cam out in front of the building. And in the fall of 2005, we had a gentleman show up in a gurney having seizures, and the hospital attempted to drop him off. But the captain of the police force, Andy Smith, happened to be at our place in a meeting. He ran down, intervened, made the man, the ambulance driver, put the man back in the ambulance and sent him back to the hospital. And then shortly after that, in December, undocumented day laborer showed up covered in blood, and he'd just been released from a hospital in Arcadia, brought all the way to downtown Skid Row, walked in. We took him back to our guest area, and shortly thereafter he became so ill from the beating that he'd taken right before he went to the hospital that we had to call the medics and haul him back to the hospital, and he stayed there for several days. That was publicized. I think 11 hospitals were documented as doing drop-offs. It was somewhat publicized, but in March of 2006, I was standing outside with the moms from the mission waiting for their kids to return. Their bus had been in an accident, so I was out much later than I normally would have been. And I couldn't believe my eyes as a cab pulled up and did a U-turn, and a little lady in a nightgown stepped out of the back of the cab, unassisted, was given no directions to our door. She's several hundred feet from our door, and she started walking northward on San Pedro to some of the meanest streets in the United States. Fortunately, I was there. I called the captain, Andy Smith. I sent a staff person to rescue the lady that I later found out was Carol Reyes. Hospital documents showed that she had high blood pressure, a low-grade fever, had dementia so bad that she didn't know time or place, and yet she was brought 20 miles to be dropped off onto the meanest streets of our city. And every good thing that happened to Carol Reyes after it hit the national and world news of what had happened, every good thing that happened to her could have happened had she been treated like a human being in the first place. She was given a checkup by a social worker and doctors. She was deemed to be not competent. She was given a public guardian. She was given a lawyer. She was put into a group home, and today she's being cared for in a wonderful way. But every one of those good steps could have been done in the first place rather than after she made the national news. Unfortunately, there's been over 35 hospital drop-offs since Carol Reyes made the news. One man, a paraplegic, dropped off without a wheelchair, without a walker, dropped himself out of the van, pulled himself to the curb with his clothes in his mouth and his colostomy bag ruptured, leaking on the ground. And fortunately, one good thing that came out of this was that 12 homeless witnesses stepped forward and said, enough is enough, no more of this kind of treatment for human beings. I'd like to just share a scripture from the Old Testament. As the Jewish people were heading back to set up their city once again, they received instruction from God through the prophet of Isaiah, and it says, I'll take joy in Jerusalem, take delight in my people. No more sounds of weeping in the city, no cries of anguish, no more babies dying in the cradle or old people who don't enjoy a full lifetime. 100th birthdays will be considered normal. Anything less will seem like a cheat. And I want to steal an idea from Michael that we need to move away from the pull yourself up by the bootstraps, winner take all, me-centered society, and move to a we-centered society. And that's why I'm here to encourage you today. Thank you.
Thank you very much.